If you're over 60 and feel like you're standing crooked, regardless of whether or not you've been formally diagnosed with scoliosis, then this video is for you. I'll share one simple trick to treat scoliosis in adults over 60. And I promise I'll jump right into that in less than a minute. But the one thing you need to understand first is what causes scoliosis in adults. And typically that's repeated or sustained asymmetrical postures repeated over the course of years or more likely decades. That may include persistently leaning off to one side when you're sitting, habitually standing with weight more on one leg than the other, or carrying a heavy bag or purse over one shoulder. And when you do that repeatedly over the course of time, the muscles on the concave side of the curve get stiff and tight, and the muscles on the convex side of the curve get lengthened and weak. And so the one simple trick to help treat scoliosis in adults is to stretch the muscles on the concave side of the curve and to strengthen the muscles on the convex side of the curve. Now, conceptually, that's very easy. To put it into application is a little bit different. So in the rest of this video, I'll describe some examples of how to do that. Now, there are two primary types of scoliosis curves. You can have a C curve where the spine just scoots off in one direction and then comes back to midline. You can also have an S curve where it scoots off to one side and then there's a compensatory curve in the other direction. So it makes it like the letter S. And the treatments for those are a little bit different. So let's start with the C curve because that one's conceptually a little easier. The curvature is this way. And so the concave side is over here, the convex side is over there. And one simple treatment for this one is just to put the hand on the concave side over your head, take a deep breath and fill the rib cage on this side while reaching up towards the ceiling. This applies a distraction or stretching force as well as a side bending away from the direction of the curve. So it brings you more into a midline position. Now, at the same time, you're using your intercostal muscles and your oblique muscles to side bend you to the opposite side. So you're stretching over here on the concave side and strengthening on the convex side. Repeat that for 5 to 10 breaths and then try to do that frequently throughout the day, every day. Because remember, this is something that develops over the course of years with repeated and sustained postures. So you want to undo the side that you've been leaning to. Now, the S curve is a little bit more complex because the curves go in different directions. And so regardless of which way you lean, you're always going towards one convex curve and one concave curve. Now, treating an S curve requires a little bit more mental gymnastics, but here's how you do it. Let's say for this example that there's a convex lumbar curve, so it's convex over here, and then a convex thoracic curve on the opposite side. So to undo that, we're going to start with the lower back curve or the lumbar curve. If you're bent over this way in the low back, you bring the rib cage towards the top of the opposite pelvis and then contract the oblique muscles over here. Now, as you do this, reach the other arm up, so this arm up, and we're going to lean towards the side of the thoracic curve that's convex. So keep the rib cage pulled down towards the pelvis and then reach this arm up in the air and try to breathe into this rib cage. So you're side bending your upper back in this direction while side bending the lower back in that direction. Breathe in and then breathe out and repeat that for 5 to 10 deep breaths. Now, balance can sometimes be an issue there. So if you are having a little bit of difficulty with that, you can also do this up against a wall. So you'll kind of push your pelvis in towards the wall to side bend this way, and then reach your arm up and come in towards the wall. So you're reaching up with this side bending your upper half into the wall while pushing your hip or pelvis into the wall, which side bends you the other way. So get to see that one more time because it's a little bit confusing. Rib cage down on this side, arm up in the air, breathe into this side of the lung, and then lean towards the opposite side. Now, both of these assume that you're starting with a level pelvis to begin with. And if you have one leg that's longer than the other, then that can start you out in an asymmetrical posture. And in fact, it is possible to have a scoliosis curve that develops as a result of a leg length discrepancy. So to learn how to treat a leg length discrepancy, check out this video over here. Or if you're more concerned with a hunchback curve, check out this video over here. But before you go check those out, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.